Okay, you're called Code Red for a 32-year-old male who's found confused and sweaty at work.
Okay, so we're going to a workplace, going to make sure we have an entrance and an exit as well, going to make sure there's no crowds. Mechanism of injury, this is a workplace, this could be anything, heat exhaustion, maybe AC, could be a medical condition. There's just the one patient. I don't need anyone right now except my partner who's here. And PPE, because it's a code red and he's not feeling well, we're going to don all full droplet precautions. So when we get there, are we like...
Yeah, you're greeted by the security. They bring you over to him.
Okay, so when we approach them, does he look at us?
Like kinda, not really.
Okay, when I'm just like looking at him, is this his position?
Yep.
Okay, and is he didn't really look at us?
No.
You said? Okay, and breathing. Do I see regular breathing? Is there any abnormal noises?
No, you see some normal breathing.
Okay, how's his skin color and condition?
It looks sweaty.
It looks sweaty?
Yeah.
Okay. Hi there, sir. I'm Annie. This is my partner, Nick. Can you tell me your name and age?
My name's Ron. I'm 32.
Okay, Ron, can you tell me what's going on?
I don't know.
You don't know? Okay, do you know where you are right now, Ron?
No.
Is it alright? My partner's just going to take some of your vitals right now. Yeah? Okay. Can my partner let me know when the vitals are ready?
Yeah.
My partner's a ghost. Thank you. So, do you know what time it is, Ron?
I don't really know.
You don't really know? Okay. Do you know what you're doing?
Sitting down.
Sitting down, okay. And is there anyone else here? Any bystanders, coworkers?
Yeah, one of his coworkers is here, and all his answers are like pretty slurred and
It's coworker.
slow. No.
Okay.
Ron's.
Okay. So, I'm just gonna look. Is there any like droop of the face? There's slurred speech?
Yeah, there is
No
slurred
droop in
speech.
face though? Maybe? Okay. Just gonna look at the pupils. And the pupils, how are the pupils curl up?
There's
Yeah.
3 and reactive, yeah.
Okay. And just looking at the trachea, is it midline? And is there any JVD?
It's midline, there's no JVD.
Okay, and I'm just gonna get you to take a deep breath. I wanna feel that it's symmetrical. Take a deep breath. There we go. Okay, and I'm just gonna also take. Can you take a deep breath for me? Can you take a deep breath? Another one. Another one. Another one. Another one. Perfect. And coworkers here, did Ron have any falls recently? Any trauma?
No, he was just sitting at his desk, and then I came over, and he seemed confused and kind of right out of it.
Okay, and has this ever happened before?
It happened like a couple years ago, yeah.
This happened a couple years. Okay, does Ron have any allergies or medical conditions?
No allergies that I know of, but I know he has diabetes.
He has diabetes. Okay. So does my partner by any chance have the
Yeah, they have the vitals. They're on the board.
Okay, perfect. So it does look like the blood sugar is a little low, so we're gonna want to administer dextrose IV, which I'm gonna get my partner just to get ready for me. Just gonna ask a few more questions.
Okay.
Do you know when Ron last ate?
Yeah, he didn't eat today. He missed the work breakfast.
He missed the. Okay. And do you know if he's type 1 or type 2 diabetic? Any medical bracelets?
I'm not sure. I think he's type 1 though.
You think he's type 1? Okay. And do you know if he's good with taking his insulin?
Yeah, he took his I know he took his insulin. I saw him.
Okay, and he missed breakfast. Okay, so it looks like his blood sugar is just a little low. We've got some medication for that. Do you know how much Ron weighs?
Yeah, he's a healthy guy. He looks like, I don't know, 190 pounds.
Do you know that in kilograms by any chance?
I don't know, like 80 kilograms.
80 kilograms. Okay, so we're just going to want to administer 10% dextrose at 0.2 grams per kilogram, which will be, you said 80, so 160, or no, 16. 16 grams of dextrose IV over 3 minutes, so we're going to do that. Just going to feel a little poke. So we're gonna do that. We're monitoring for any changes in his LOA right now, and monitoring the vitals to see how they do. We're gonna recheck the blood glucose in a little bit. This can be given 2 times.
Okay.
Every 10 minutes. So we're gonna also set a timer. Looking at the time, 10 minutes from now, we can give you more if you don't get better. And we're gonna transport just because we can. I don't want to wait for 10 minutes right now, so I don't know if he gets better, but let's say Ron is not to get better, we want to bring him in because that would not meet the guidelines for that.
Okay.
Bring you to the hospital. So me and my partner, we're just gonna get the stretcher in. Bring you in. Just, hey Ron, how you doing?
Feel better.
Do you know where you are?
No.
Okay, we're gonna bring you to the hospital, alright? Just looks like your blood sugar's a little low. Okay, so we go to the hospital.
Okay, and code and C-test.
C-test 2. C-test 2 for a 32-year-old male with low blood sugar that is not going away with medication.
Okay. Yeah, see you in 5
5
minutes.
Oh, 5 minutes away.